Is Donald Trump going to lower the cost of GLP-1 medications? We're going to get into it. There's tons of news from this last week that we need to break down. And then there is a huge call to action if accessibility to GLP-1 medications matters to you. If you consider yourself on the other side of this screen, an advocate and an ally in the fight for advocacy for accessibility, I'm going to need you. So all hands on deck. But before we get started on this video, I need you to hit the like button. That helps other people see this video. Hit the subscribe button and join the OTP army, and hit the bell for notifications if you're watching on YouTube. That way you get an update on your phone every time we upload a new video. Those are all important steps to take in a small step of advocacy today. So is Donald Trump going to lower the cost of these medications? Well, what we heard in a ABC interview the last couple of days from RFK Jr. is that indeed Donald Trump has given him a directive at Health and Human Services to get the cost of GLP-1s down to closer to where they pay in Europe. Now, this is a huge piece of breaking news in terms of this administration's stance on GLPs. Now, in the past, you've heard RFK Jr., especially before he got into position, talking about keeping these medications out of Medicare and Medicaid for weight loss, instead focusing on nutrition and movement and all of the things that have sort of failed in the fight of obesity for years and years and years. The most important line from this interview, though, is that President Trump has mandated that we get the cost of these drugs down to where they are in Europe. And so that's not a passive stance on the part of this administration. I think that when we heard that this administration was not going to be covering these medications for Medicare and Medicaid, that was a huge hit to that community. But I think what we actually see happening here is a Lilly and Novo Nordisk company that have been absolutely banking on this Medicare approval. And now that it's not, there is a bargaining chip to help them get the cost down, not just for Medicare and Medicaid, but for every single person on a branded version of these medications. So it will be very interesting to see. The other things that were sort of baked into this interview are that RFK Jr. does, in fact, believe that these are game-changing medicines that people should have access to through Medicare and Medicaid. However, he believes that there should be a sort of step therapy requirement to track people's progress using first-line interventions of nutrition, movement, and prevention. And if those are not met, then accessibility to these medications for obesity management should be allowed. So you see them sort of debating this within the administration. You see Mehmet Oz, who is actually in charge of Medicare and Medicaid services, a huge proponent of these medications. And so you see there's definitely tension within the administration of people with different perspectives. But all in all, I echo the sentiment that I had at the beginning of this year. I think this has a opportunity to be a bullish year on accessibility to these medications. Now, when we talk about getting prices down to where they are in Europe, there isn't great data on what they are paying currently. But generally speaking, semaglutide in the United States list price for Ozempic is around $1,000. You see the NovoCare offering now all doses of Wegovy for $5.99 a month. That is, or $4.99 a month, excuse me. When you go directly to NovoCare, all doses of Wegovy are now available if you go around the PBMs for $5.99 a month. But you can still get Ozempic in the UK for around $93 a month, France for $83 a month, Germany and the Netherlands around $100 a month. There's still quite a disparity between what we're paying here, even with the direct prices based upon what people are paying in other parts of the world. And so this would be huge if this administration could accomplish this. Can they? Will they? I don't know. But I think that this is a positive development, and I think that this is an administration who potentially could be using Medicare and Medicaid as a bargaining chip to get the cost down, not just for the government, but for everyone. So that will be very interesting to watch. Now, on the topic of what this means for you right now, if you're on Medicare or Medicaid, not a whole lot. These meds still are not covered for weight loss. So backdoor indications are your best way to get access to them. Backdoor indications, I mean, Wegovy, which is approved for heart failure with preserved ejection fraction, for chronic kidney disease, and Zepbound, which is now approved for sleep apnea, obstructive sleep apnea, mild to moderate, associated with obesity. These would be considered backdoor indications. It's also approved for heart failure with preserved ejection fraction as well. And so these sort of non-obesity centric indications that the FDA has now approved are ways that people can get covered. I know many in our community are getting Zepbound now through that obstructive sleep apnea, but it is time for Medicare and Medicaid to cover this for obesity, and that is what we're waiting on. Even with the mandate to lower prices, there's no timeline. There's no enforcement or current savings for those patients, so we have to continue to advocate. Now, while we're waiting, we are not sitting on our laurels. One of the things that we are continuing to advocate for is prior authorization reform, PBM reform, compound accessibility in times of shortage that needs to be protected, and these employer insurance mandates. There's no safety net for people who need these medications right now and can't access them right now, and that is extremely important for the health and well-being of this country, that people can get access now. There is definitely an element to this that is time sensitive, and that is the message that we will be taking to Washington, D.C. in a couple of weeks. Of course, we're going to be working with the Obesity Action Coalition while we're there. But while I'm there, I am actively working on sitting down with some key senators in the process of figuring all this stuff out. We are working on getting meetings set up with Senator Cassidy's office. You remember the HELP hearings from last year where they brought Novo Nordisk's CEO up to the Hill and grilled him on the cost of Ozempic and Wegovy. That's the HELP committee, and the chairman this year, now that the Republicans have control of the Senate, is a Mr. Senator Cassidy from, I believe, the state of Louisiana. We are working on getting a meeting set up with him while we're there. We're working with our own senators in the state of Iowa to facilitate conversations. We've reached out to Senator John Fetterman's campaign from the state of Pennsylvania, who recently came out as somebody who has benefited from the use of Mounjaro. We need to get as many advocates in this government clanging the bell along with us. And I told you at the beginning of the year, this was going to be our focus. So if you've noticed a reduction in content from On the Pen, it's because a lot of the effort that I have been putting into this has been behind the scenes, because we're really trying to make an impact in the greater world. I told you at the beginning of the year, this is going to be our focus, and it 100% has been. And I am ready to continue to fight these battles and hopefully to get the chance to spread the GLP-1 gospel to the people who are in charge of making sure that accessibility is something that this government prioritizes. So one of the things that we're launching right now in terms of advocacy, and this is where I need everyone's help. This is where the antennas have to go up, and I'm going to need everyone's help to share this video, share the link that I'm about to share you, and everyone needs to participate. One of the main things that we're advocates for here at On the Pen is protecting the sanctity of 503B pharmacies and their ability to stand up large facilities that can mass produce medications when they're in shortage, like GLP-1 medications. Now, we know that Eli Lilly and Novo Nordisk have ended the shortage. They provided data to the FDA that has appeased the FDA and told them that the shortages are over. Are they? And that's what we want to get to the bottom of at On the Pen. So if you go to onthepen.com/report, we have been in talks with the Outsourcing Facilities Association. And in those conversations, I've asked what the community can do to support the efforts to refute the fact that the shortages have ended. Have they ended? That's what we need to get to the bottom of. So amassing and reporting experienced shortages is the request on behalf of the OFA, coming directly from the community. So please report your shortage experiences if you've experienced them in 2025. And even if you haven't, if you have found your branded medication, we just want objective data, because at the end of the day, it is my deeply held belief that 503B pharmacies should be able to produce compounded versions of essentially copies of branded medications that are in shortage. And I believe that your stories matter and should be heard in these trials, because listen, the trials that are going on in district court in Texas, which we have followed extremely closely at On the Pen, are an absolute firewall to protect accessibility to compounded medications. They should only be allowed, per the law, if the drugs are in shortage, but we should be able to tell our side of the story as a community as to what our experiences are on the ground. So my ask and my request of you, based upon what I've heard from the OFA, is that if you can go to onthepen.com/report, that's onthepen.com/report. It'll take you to this landing page where, if you would like, you can report your shortage experience in a quick form, and we will submit that data to the OFA. They will then in turn submit that data. If it does indeed indicate that shortages are in existence, right? If we're still experiencing them, they will report that to the courts. And again, I can't emphasize enough how important it is for the courts to hear from the community of people who are using these medications. So go to onthepen.com/report and report your shortage experience with branded GLP-1 medications in 2025. And we will be providing that data upon request to the OFA. This is again based upon conversations that I've had with the OFA. If you missed that conversation from a couple weeks ago, I've got that video up there with Lee Rosebush, who is the chairman of the OFA. They are once again the basically trade organization that is bringing the lawsuits against the FDA. Would love to hear your side of the story. Would love to hear what you're experiencing. And this is a way that you can jump into the fight. So I would ask that you would jump into the fight at onthepen.com and be an advocate. Share this video, share the link, and get our friends reporting the shortages. This is a very critical time. So I hope you'll jump on board onthepen.com/report. That's what I got for you today. We're going to be on top of this as it continues to evolve, and we are going to be bringing you some exciting content from Washington, D.C. in the coming weeks. Really appreciate the way everyone continues to support our work at onthepen.com and advocate for greater accessibility. Listen, the time is now. The time is now. We have the ability to fundamentally transform the healthcare system in the United States. 99% of pre-diabetics that took tirzepatide didn't get diabetes. Imagine the impacts on the healthcare system long-term. 20% reduction in major cardiovascular events for people with heart disease. Imagine the impact that has on the healthcare system. 50% of people with obstructive sleep apnea no longer needing a CPAP, off of their CPAP therapy because Zepbound has helped them to get rid of their obstructive sleep apnea. Listen, folks, the time is now. We can't afford to wait for Washington, D.C. to figure it out. We have got to protect the sanctity of what 503Bs are doing while there's a shortage, and we have to just have good data from patients to determine whether this thing is still in shortage or not. And I think that it's important that our story be told. So with that said, I'm going to sign off. We'll be back on Tuesday with a podcast. Again, the number 13 podcast in the U.S. last week. Absolutely amazing. While you're there, give it a 5-star rating and review. Keep doing your thing. We are going to continue to advocate and fight together. Until the next one, I hope that you have a great rest of your weekend. Let me know in the comments if you're ready to fight. Can't wait to do this all with you. Check out the next one.